In this lesson, we'll continue our discussion of the systemic circulatory routes by taking a look at the arterial blood supply to the brain. So we'll look at specifically how the brain tissue gets its blood supply. Then we'll take a look at the arteries and veins that are in the thorax, the chest area. So let's begin by taking a look at the arterial blood supply to the brain. From the previous lesson, there were two arteries that we had taken a look at. The internal carotid artery, which was a branch off of the common carotid artery, and then we had looked at the vertebral arteries. And in that lesson, we had said that the internal carotid artery and the vertebral arteries enter the cranial vault and they're going to supply the brain. That's why we want to look at them again. So we're going to see that the internal carotid artery, once it's inside the cranial vault, has three major branches. There's the ophthalmic arteries. You could probably guess from their name that they're going to be supplying the eyeball. There's the anterior cerebral artery, which is going to go towards the frontal lobe, and then the middle cerebral artery, which is going to go towards the parietal lobes. So if we take a look up over here, just to remind you, we had looked at this picture in the previous lesson. This is a view of the right side of the neck. So this is the brachiocephalic trunk. Right, this is the first branch off of the arch of the aorta, and it's on the right side. That's why we see it. Then it has a common carotid artery on the right that comes up, and then about the level of C4, that's split. Here's the internal carotid artery right here. That's what we're going to follow now into the brain. Right, in the previous lecture lab, we had done this out over here. Right, so now we're going to follow this. So this is the internal carotid, and then we had also follow the vertebral artery up to this point. Now we're going to follow it inside the brain. Okay, so the vertebral arteries inside the cranium, once they enter the foramen magnum, we're going to see that the two vertebral arteries actually unite to form this pretty big blood vessel known as the basilar artery. The vertebral artery and the basilar arteries, they're basically supplying the back part of the brain. They're getting the brain stem, the cerebellum, which is posterior, and the spinal cord. The basilar artery is also going to give rise to the posterior cerebral arteries. So we're kind of covering most of the cerebrum, right? Anterior cerebral artery here, middle cerebral artery here, and the posterior cerebral artery is kind of covering most of the brain. So once those arteries, the vertebral arteries and the internal carotid arteries, enter the brain, they're going to form something that we used to call the circle of Willis. A lot of older practitioners, medical people, anatomists still call it the circle of Willis. They now call it the cerebral arterial circle. So what I'm going to do is I'm actually going to skip these notes for a moment, and I'm going to jump ahead to this picture here. This is actually a picture I want you to be able to label. I want you to be able to label this if I were to put this on an exam. So let me show you where we are. It looks intimidating. It's not that bad. We're going to divide this into two parts. So right here in the middle, this is the pituitary gland, right? So this is about the level of the sella turcica. And on either side, right here, this is the internal carotid artery coming up from the neck. Right here is one. And then here's going to be the other one. Right? So we have the two internal carotid arteries. So if you notice now, we said that the internal carotid artery has three branches that I want you to know. This branch right here, this little guy right there, would actually go to the eyeball, which would be sitting right here. Now this is an inferior view of the brain, right? So that we would see if the eyeball was here, here's actually the optic nerve, right? This would go to the back of the eyeball. So right next to the optic nerve, right there, that little guy right there is the ophthalmic artery, and we could see it on the other side also. So that's the first branch off of the internal carotid. The second one that I want you to be able to find, look at the size of this thing. It is massive. It is a big blood vessel running, again, off either side. This is going to go to the parietal lobes. This is going to be the middle cerebral artery. Okay, so that's the biggest branch. Just from a clinical point of view, this is the artery that most commonly develops a stroke. And then going forward towards the frontal lobe, right there, this blood vessel on one side and then this blood vessel on the other side, that is the anterior cerebral artery, right? So again, right here is the internal carotids, ophthalmic branch, middle cerebral artery, and then in the front, anterior cerebral artery right there, okay? Now, looking at the back, here, coming up from the spine, is our vertebral arteries. Once they enter the foramen magnum, look what they do, guys. They actually unite to form this big blood vessel right here. This is the basilar artery. Okay, so the two vertebral arteries, as they come up the spinal cord, up the spinal column, I should say, once they come into the brain area, they unite to form the basilar artery. And this basilar artery gives rise to the posterior cerebral artery. So this one going back right here is the posterior cerebral artery. Right there. Posterior cerebral artery. These here you don't have to worry about. These are ones that go to the pons. These would be called pontine, and these are cerebellar. I'm not too worried about those. For me, just make sure you know the basilar and then the posterior cerebral. So what we have is these blood vessels here that came off of the internal carotid, and then we have these blood vessels here that came off of the vertebral arteries. Now what we're going to do is we're going to tie them together, forming an anastomosis. And if you remember from my previous lesson, an anastomosis is when blood vessels join together. So watch this. Connecting this basilar part right here to the carotid artery here, the internal carotid, this blood vessel right there, and then on this side here is the same one. This is called the posterior communicating. So what we did now is we connected this basilar artery to the internal carotids. Then connecting kind of like the left side of the brain with the right side, there's a connecting one right here between the two anterior cerebrals, that little crossbar right there. This is known as the anterior communicating artery. So what we have now is this complete circle right over here. So let's say, God forbid, one of these blood vessels became blocked here. These other blood vessels can bring blood to the brain adequately. All right, so this is a good example of an anastomosis. And like I said, we used to call this the circle of Willis, right? They now call it the cerebral arterial circle. All right, so it's kind of divided into two parts. That's how I do it. Again, the internal carotid artery part, and then the vertebral artery part. Again, the internal carotid artery part has the ophthalmic, middle cerebral, and anterior cerebral arteries, right, on both sides. The vertebral part, once those two vertebral arteries come into the cranial vault, they form the basilar artery. The basilar artery will now give off arteries that go to the posterior lobe. This is going to be called the posterior cerebral arteries. And they're going to kind of go to the occipital lobe. Then we want to take this basilar system and tie it to the internal carotid system. How are we going to do that? This little communicating artery right here, this, and here's the equivalent one on the other side, is known as the posterior communicating artery. Then kind of tying the complete circle so that the left side and the right side are connected. That little guy right there, right above my cursor, is the anterior communicating artery. Just one clinical note if you're going into medicine. You'll actually learn in pathology that many times blood vessels will develop these conditions known as an aneurysm. Um, Aneurysms frequently occur where there's like bifurcations, where they're splitting. So like let's say here, 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 that type of thing. Many times these are called berry aneurysms in this region, and the problem is if they burst, it could be fatal, right? It could happen to anybody in any age. So you will hear about that, aneurysms around the circle of Willis. Okay, so just make sure we have everything. So again, we got the internal carotid artery. You should be able to identify and label the ophthalmic, the anterior cerebral, and the middle cerebral arteries. This one's the big one. Like I said, this is the one that most commonly develops a stroke. The vertebral arteries, they come in through the foramen magnum, as we said in the last lesson. Once they come in, they unite to form another artery that you should be able to label called the basilar artery. Right? And then that basilar artery is going to give rise to the posterior cerebral artery. Then we can tie now this system to this system by the communicating arteries, right? So the circle of Willis, or the cerebral arterial circle, is formed by the union of the right and left internal carotids with the basilar artery. Okay, and it's done by the anterior communicating, you should be able to label those, as well as the posterior communicating arteries. Right? That makes this complete circle now. And again, this connection, these communicating arteries are forming this connection known as an anastomosis. Right? So we're getting blood flow from both the carotid and or the vertebral arteries. Okay, here's just a blow up. Again, internal carotid, ophthalmic, anterior cerebral, middle cerebral, basilar, posterior cerebral, and then here's the tie-in is right here. Your two communicating arteries, posterior, and then your anterior communicating. That's a great picture, nice and blow up. Again, very important clinical area. That's why I want you to know it. This is another perspective kind of showing how these arteries come in. Here's the internal carotid artery coming up through the neck and then entering through the carotid canal, and then you can see it come up like here, and then watch this. Here's the ophthalmic artery going to where the eye would be right there. Here's your anterior cerebral going to the frontal lobe, and look at this, is that massive one, that middle cerebral going to the parietal lobe, right? Like here's your precentral gyrus, here's your postcentral gyrus right over here. Just an important clinical area. Then we can see the vertebral arteries coming up. Once they enter the foramen magnum, they become the basilar artery right here. And then the basilar artery gives rise to the posterior cerebral, which would go back to the occipital lobe. Right, so it's just another perspective. Okay, so let's finish up this lesson by taking a look at the blood supply to the thoracic cavity. So the thoracic aorta is going to come from the arch of the aorta. It's part of the descending aorta. Anything above the diaphragm would be considered the thoracic aorta. So watch this. If we go to this picture here, we had looked at this in a previous lesson. Here's your ascending aorta, arch of the aorta. So now all of this, look at the size of this thing, this big blood vessel going down, is the descending aorta. Above the diaphragm, the descending aorta is called the thoracic aorta, which we're going to talk about now. And then below the diaphragm, we call it the abdominal aorta. Excuse me. All right, excuse me. So this is going to be the thoracic aorta. All right, so that's what we're going to look at now. So the thoracic aorta has a bunch of different arteries that come off of it that you're probably not going to see on the models that we have, but the names kind of tell you where they go. For instance, the bronchial arteries, or if you think about it, are probably going to the lungs, where they're going to do a lot of the respiratory tract, the pleura, which surrounds the lungs, the bronchial lymph nodes, oh, I'm so sorry, and the esophagus. The esophageal artery, right, you can probably guess, goes to the esophagus. The mediastinal artery goes to the mediastinum, and then the pericardial artery is going to go to the pericardium. So these are small blood vessels. Like I said, you're not going to be able to find them on our models, but I do want you to know their names and just have a general idea where they're going. It's not that difficult because the name tells you where they're going. So you can see right here, again, here's like the bronchial arteries, right below it, the esophageal arteries, below that, the mediastinal and the pericardial. Right? Like I said, most of our models in the labs won't show these. Okay. Oh, went the wrong way. The thoracic aorta does have some blood vessels, which we will see on our model, that's going to go more to the body wall structures, not so much going to organs. The ones that you're going to see actually run between the the ribs. These are known as the intercostal arteries, right? Inter means between, costal means the ribs. There's actually 9 pair of arteries that come off the thoracic aorta, and they basically supply the intercostal muscles, the chest muscles. These also go to the pleura, the breast tissue, the vertebrae, the meninges, and even the spinal cord. So if you take a look over here, guys, these blood vessels here, if you like to look just under the ribs here, those are your intercostal arteries, right? So there's going to be 9 sets of those on each side. And then before I go back to the notes, the last blood vessel that comes off the thoracic aorta, you can see this one right here on the top of the diaphragm, that is called the superior phrenic artery. Right? So the intercostal arteries and the superior phrenic you are going to see on our models. This is what our book calls the somatic branches, meaning that they go to the body wall. Those other branches, the ones that you're not going to find on our models, this is what our book calls the visceral branches, in that they go to the that they go to the organs. Okay, so take a look on your models and on this diagram, be able to find the intercostal arteries as well as the superior phrenic, right? Superior phrenic. Okay. So one of the veins, I'm going to introduce it in the next lesson when we do the blood vessels of the abdomen. One of the veins that starts in the abdomen is the inferior vena cava, and then it runs up through the chest into the right atrium. So even though the inferior vena cava is in the thorax, I'm going to save that for the next lesson. I want to finish up this lesson by showing you a system of veins that drain the body wall, and ultimately they bring the blood from the body wall, the frame, into the superior vena cava. And we call this system the azygos system. Some people say azygos, some people say azygos, however you pronounce it, both are correct. So there's 3 blood vessels that make this up. If you want to give a highlight in your notes, the azygos vein, the hemiazygos vein, and then the accessory azygos vein. I'm going to go to a picture that I glommed off the internet first, just to show you this. What they're showing you is where the vertebral column would run right here. Right, so they show you like T7 and T8. They cut the superior vena cava where it goes into the heart. The heart would be right here, and then they cut the inferior vena cava, which would go like kind of up this way. So they cut the inferior vena cava so we could see some of these blood vessels. So running along the right side of the vertebral column right here, this is going to be our azygos vein, and you can see there are intercostal veins draining the frame, the wall of the thoracic cavity, right? And these are all contributing to the azygos vein. And we're going to go over that in the notes for a minute. It even gets blood from the ascending lumbar vein, which comes here. So these are all body wall veins right here. So this is going to be the first vein that we take a look at. It's on the right side. When you look at the model, you're going to see it on the right side, the azygos vein. Then coming up on the left side here, this is the hemiazygos vein. Notice this blood vessel also gets from the intercostal veins. All right, so it's draining the frame, the body wall, and it's also getting an ascending lumbar vein over here. But this one, as this hemiazygos vein comes up, somewhere, because it's variable on everybody, it crosses over and dumps its blood into the azygos vein, which continues to bring the blood up to the superior vena cava. All right, so this vein here is the second one that I want you to know, hemiazygos. Then the third one is going to be this one coming down here. You could see it again, draining body wall structures because it's got these intercostal veins draining into it. This is the accessory hemiazygos. Some people say accessory azygos vein also. Right, so you could say accessory hemiazygos, accessory azygos. I've seen both. This one also, at some point crosses over to the azygos, right? I've seen variations where this one here dumps into the hemiazygos, right? It's very variable. So that's where you're going to find these blood vessels. The right side is going to have, again, right of the vertebral column, the azygos. To the left on the bottom, hemiazygos, and to the left, but on the top, the accessory hemiazygos. Again, this accessory hemiazygos and the hemiazygos dump their blood into the azygos vein, and the azygos vein brings it up to the back part of the superior vena cava. It actually enters the posterior aspect of the superior vena cava. So let's go back to the notes for a minute and take a look at the azygos vein. So again, like I said, guys, this is located against the right side of the vertebral column. It arises from the ascending lumbar veins, right? That's going to be on the right and the left, and it drains most of the right abdominal cavity wall and the right and also from the right posterior intercostal veins. That's what I was showing you right here. All of these are the intercostal veins right here, and these are going to be the intercostal veins on the other side. And then here's the ascending lumbar vein. The hemiazygos vein ascends the left side of the vertebral column, right? It arises from the left ascending lumbar vein, right? So all I'm saying is going to be on the lower left, and it comes from the ascending lumbar vein right there. And it's also receiving from the posterior intercostal veins. About mid-thorax, I can't tell you exactly where because it's variable. It's going to cross. It's going to cross in front of the spinal column and dump the blood into the azygos vein. So that's what I'm showing you right here. Here's your hemiazygos right here. Comes across and it dumps its blood into the azygos vein. And finally, guys, the third one is going to be the accessory azygos vein, or the accessory hemiazygos vein. It arises from the fourth through the eighth posterior intercostal veins. As you can see, it's kind of arising from right here. Again, it's variable. And then it's going to descend to the left side of the vertebral column, right? So it's coming down, and then at some point it also crosses over to the azygos and dumps its blood in there. Like I said, I have seen variations where this dumps into the hemiazygos also, so it is variable. Okay, and that's going to be the third one. So this is what we call the azygos system. Okay, so in this video we had taken a look at, or this lesson, we had taken a look at the blood supply to the brain, taking a look especially at the branches of the internal carotid artery, the branches of the vertebral artery, and then the formation of the circle of Willis. Then we took a look at the thorax, the blood vessels of the thoracic aorta. We mentioned the visceral blood vessels that you're not going to find on a model, and we did look at the intercostal arteries, which you are going to find, as well as the superior phrenic artery. Then we finished up the lesson by taking a look at this system known as the azygos system. And again, I need you to know the location of the azygos vein, the hemiazygos vein, and the accessory hemiazygos, or the accessory azygos.